So good morning, everybody. Thank you very much for joining us today. I'm Katherine Thompson and I head up the Cardiovascular Disease Prevention Programme at Public Health England. And I'm really pleased to say that we're joined today by Katharine Jenner, who's the Chief Executive at the Blood Pressure UK charity. And she's going to be talking to us today about next week's awareness campaign, which is the Know Your Numbers campaign, and the importance of raising awareness of high blood pressure across the population. We've got an hour for this session and it's going to take the format of Katharine doing a short presentation, and then we'll have time for questions, answers, and to share experiences and to share your thoughts and reflections as well. So I'd like to hand over to Katharine.
Hello. Morning. Hearing me okay? Yes. That's great. Thank you so much for having me. I'm really thrilled to be here to talk to you all today. PHE have always been really big supporters of Blood Pressure UK and our Know Your Numbers campaign. Today I'm going to just quickly take you through a bit of a recap about what blood pressure actually is and how it causes CVD, a little bit about COVID and its implications, sorry we have to talk about it, and then really focus on detection and treatment, how we get it under control, and how you can hopefully get involved and know your numbers. So hopefully be about 20-25 minutes, and then as Katharine says, we really want to hear your experiences at the end, so hopefully some time for questions. So Blood Pressure UK, if you don't know us, we're the only charity for people with high blood pressure. And if you have high blood pressure, our information and support services, we have membership that can help you control it. So we've got lots of practical information on all aspects of the condition, including treatment, lifestyle, home monitoring. We also do quite a lot of work around prevention. We're headed up by our chair, Professor Graham McGregor, who, if you know him, you might know him from his pioneering research and campaigning work on salt and more recently sugar and obesity as well. And we're all based at Queen Mary University, the Wolfson Institute. But if you know us, you probably know us from our national blood pressure testing event, which is Know Your Numbers, which happens to start on Monday. So this is very timely. Next slide, please. I know my numbers, I have to. Do you know your numbers? If I was to ask you, do you know your numbers? Do you know what I'm talking about? And if you do know what I'm talking about, do you know what they are? If you know what they are, do you know what they actually mean? And even if you know what they mean, do you know what to do about it? So I want you to think throughout this talk, not just about you, but about your family, anyone you come into contact with. We want to try and break down the barriers to blood pressure testing and treatment and try and make it as simple as possible. Next slide. So I think there's a bit of an assumption that everyone just knows what blood pressure is, but I've found that is very much not the case. So I'll just give you a little 101 here. It is the force of your blood pushing against your blood vessel walls as it flows around your body, pumped by your heart. It's measured in a unit of pressure, millimetre of mercury, and your blood pressure is written as two numbers. So one is the top number as your heart beats, the higher number, that's when the blood is pumped out to the blood vessels, systolic. Systolic, so I remember it. And the second number is between the heartbeats when it's more relaxed and the heart is filling up, and that's the lower bottom number, the diastolic. Unfortunately, the way it looks with number over the top and the bottom makes it look like a fraction, which makes it look more complicated than it is. So if you need to remember anything at all, remember the top number. That's the most important. And these numbers are very, very variable. They can vary depending on what you've just eaten, what activity you've just done, even what time of day it is. And your blood pressure numbers can be healthy. It can be low. Often hear about people talking about low blood pressure, but more often it can be high. So NICE defines high blood pressure, known as hypertension, as a clinic blood pressure of 140/90 or higher. And it's known as the silent killer because it rarely causes any symptoms, yet it's responsible for half of all heart attacks and 2/3 of strokes. Is a major risk factor for chronic kidney disease, heart failure, and dementia. But people don't know they have it because it doesn't really show any symptoms. It's got a number of causes. There's no one particular cause. Quite often it can be as a result of another illness, particularly kidney disease. But the type that most people have doesn't have a particular cause and comes down to a number of different factors. So growing older, your genes, your family history. If you're from Black or South Asian descent, you're much more likely to have it. But the most important thing for most people is their lifestyle. So what you eat, what you do on a daily basis throughout your life decides what your blood pressure will be. So if you have an unhealthy, salty diet, are overweight, have a lack of exercise, smoke, drinking heavily, this will all raise your numbers. And if you do less of these things, it will lower it. Now, those risk factors might sound quite familiar. A lot of people in the UK have quite an unhealthy diet, quite a salty diet, are overweight, do have a lack of exercise, smoke and drink. So it's no surprise that a lot of the population are affected by high blood pressure. It's not a very exclusive club. And just like obesity and type 2 diabetes, which share a lot of the risk factors there, these risk factors are very dependent on external environmental, social factors rather than just personal responsibility. Luckily, blood pressure doesn't seem to have quite the same sort of stigma and blame surrounding it as obesity. So we're a lot more open to talking about it and trying to do something about it. But whereas obesity is pretty well understood by the public, blood pressure just hasn't really been in the spotlight in the same way. I think it'll be a long time before we see Boris Johnson on the front page of the Times declaring a war on blood pressure. But perhaps he should be, because it affects more than 1 in 4 adults in England, around 12.5 million people, and is a big cause of death. How does it cause cardiovascular disease? So when your blood pressure pushes with too much force against the artery walls, the walls become damaged. And over time, the blood vessel walls become thicker, plaque deposits narrow the lining of the artery, and the space that the blood has to flow through gets narrower. So blood can't flow through as easily as it should, and the heart has to work extra hard to force it around. And if it's not brought under control, which it actually very easily can be, it can lead to a range of problems. So poor circulation and pain in the legs, feet and chest, and heart failure. And then blood clots can form in the damaged arteries and become lodged in a blood vessel, causing heart attacks and strokes. So it's all a bit sort of negative. But the good news is that high blood pressure is usually preventable and it's very treatable, which is why knowing your numbers is so important. However, half of the adult population in England do not know what their blood pressure reading is. So you will, I'm sure, all know that improving cardiovascular outcomes is central to the NHS long-term plan. Cardiovascular disease, such as heart and strokes, have been identified as the single biggest area where the NHS can save lives because they're so preventable. And high blood pressure puts a real strain on the NHS. The associated costs of stroke, vascular dementia, coronary heart disease, chronic kidney disease, they run up to about over 2 billion every year. We conducted some research for our Know Your Numbers Week next week, a survey of over 2,000 individuals by census-wide, so I'll drop in some figures as we go, but we found that only 8% of the population considered heart disease and stroke to be their biggest health fear. So even though it's a huge problem, the public are not really that interested in it at the moment. Next slide, please. This disruptions to cardiovascular care, particularly during COVID. So we have to talk about it, but high blood pressure itself was never on the government's high risk list of health conditions, and evidence from hospitals around showed that people with high blood pressure were not more likely to catch coronavirus or have a more severe reaction to it. But the pandemic has caused massive disruption across the CVD pathways and widened regional inequalities which were already in place. So, for instance, people living in Blackburn were twice as likely to die from CVD as those who live in Chelsea. There's been a big disruption to prevention, diagnosis and treatment. This chart here is from the Institute of Public Policy Research, IPPR think tank, a great report called Without Skipping a Beat with CF Healthcare. And they got data from NHS Digital and found that there were almost 80 million fewer in-person GP appointments between March and December last year compared to the year before. And although there was a real, huge rise in telephone GP appointments, information that's usually gained from face-to-face clinical examination, such as the health checks, which are especially important to identify high blood pressure and abnormal heart rhythms as well, were lost. As well as identification and medical therapy, hypertension prevention focuses on lowering risks through behaviour change, so lifestyle advice, diet, weight, smoking, drinking and exercise, that would have been lost as well. Around 1 in 6 health checks identifies a high-risk patient for CVD. And you can see a 90% drop-off. About 50,000 patients were not identified as high-risk during this period, and about 10% of those were not started on antihypertensives when they should have been. That's the treatment for high blood pressure. And the missed prescriptions alone, if these people are not found, diagnosed and put on treatment, are estimated to lead to an additional 12,000 heart attacks and strokes in the next 5 years. Public Health England's own data showed there were over 5,000 more CVD deaths last year than expected, only half attributed to COVID-19, meaning CVD deaths are now at the highest level seen in a decade, which is such a shame, even at a younger age, because the trend really was on the downward trend. And this will be the tip of the iceberg. CVDs are long-term conditions. And most of the disturbance seen has been to early detection and to secondary prevention, meaning the biggest impacts are yet to unfold. Next slide. That is why it is so important that we collectively, across PHE, NHS, charities, everyone in the CVD pathway, focus on finding those people who should, who could and should have been taking action, and this will help prevent some of the 12,000 extra deaths. I just want to mention here the CVD Prevention Packs. This is, if you've not heard of them, so the Public Health England's free cardiovascular disease prevention packs for health professionals, which are aimed at meeting the 10-year ambitions set out in the government CVD Prevention Programme. They present local data for behavioural risk factors, inequalities, NHS health checks, detection and treatment, some other things as well, cost savings, and CVD events avoided as well. And they're very detailed local breakdowns presented at an STP, CCG and practice level. So if you're a health professional, you can get access to your free packs from PHE through the fingertips, and I think there'll be a link sent out. Next slide, please. But this is what we do, know your numbers. So we are planning for next week, and what we do generally, in fact, is to raise awareness about the risks of high blood pressure. We want to encourage the nation to use simple, reliable blood pressure monitors to measure their blood pressure at home or anywhere, and to take the necessary steps to reduce it if their readings are considered high. Firstly, I want to talk about finding the missing millions. How do we find them? So as we've said, it's often called the silent killer because it rarely has any symptoms. And so as many as 6 million people are undiagnosed and will only find out that their blood pressure is too high when they're screened before a procedure, if they have an opportunistic screening, or if they have a heart attack or a stroke. There's only one way to know your blood pressure numbers, and that's to have it measured using something like this. Thankfully, no tubes, so not affected by the shortage on blood test tubes. But this is it. It's very quick, it's simple and painless. And ordinarily it's free. If you can go somewhere else, you can spend 20 quid and buy one yourself. But you can go along to a GP, it's part of a health check, practice nurse or pharmacist, which I'll talk about, or you can do it yourself at home. So there are a few places that you might get your blood pressure tested: pharmacy, clinical setting, community testing, or at home. So I'll just briefly touch on the first three. In pharmacy teams have got such an enormous opportunity to promote health at local level. For some people, the local pharmacy will be their first point of contact, or even their only contact with a healthcare professional. So there's been a new deal brokered by Dr. Shahad Ahmed, Helen Williams, Dr. Keith Ridge, and from the pharmacies and a few others, that pharmacists are going to be able to offer blood pressure tests and give clinical and lifestyle advice. Then they're going to, very importantly, record this information in a process that is going to speed up access to care by joining up services and treatment with GP and other local services. So it's a really fantastic initiative launching in October, I believe, of which we can share more details. Clinical setting, that's the place that most people know about it. So appointments and health checks as well. Practices should absolutely prioritise blood pressure detection. It should be embedded and implemented as part of local CVD prevention strategies. Encourage people to take up NHS health checks and include things like digital home blood pressure monitoring linked to GP surgeries. See what we can do about having more medication reviews digitally as well to try and take the pressure off there a bit. Community testing is where we normally live. So on Know Your Numbers Week, we normally have hundreds of organisations taking part, setting up pressure stations in public places across the UK, from hospitals, health centres, offices, car parks, supermarkets, even the Albert Hall. And Know Your Public Health England, your offices in Skipton House and Wellington House have held events before as well. This year is our 21st anniversary of Know Your Numbers, and due to social distancing measures, we're not going to be doing community pressure stations, but we're still encouraging the whole of the UK to know their numbers. We're focusing on it being the forgotten pandemic of high blood pressure and how this is a golden opportunity to improve control. So we want to make this a year of blood pressure monitoring, and we need your help to spread the word. Next slide, please. Showing okay. So this is a graphic of our blood pressure testing guidance. So home blood pressure monitoring is an effective and inexpensive way to keep blood pressure under control, and the evidence behind it just continues to get stronger and stronger. It gives you a way to take control of your health. There's no need to visit anybody. Many people find that measuring their own blood pressure helps them feel more in control of their condition and feel more motivated to stick to lifestyle changes and medication as well. So we want everyone this year to know their numbers and to find those with undiagnosed and particularly uncontrolled high blood pressure. That's people that have got high blood pressure and not brought it under control yet. Now, the tech does look a bit techy. We don't sell or promote or endorse any monitors, by the way. If you want to find one, I would suggest you go to the British and Irish Hypertension Society, where they put all the clinically validated monitors there. But as I say, they range from anything, to 20 to £100. So what we've got on our website is an online resources hub, which has got everything you would need to know, including this graphic, how to buy a monitor, how much to spend, what kind of cuff size you need, as well as to how to take an accurate reading, really just to try and demystify it and show how simple it is. We've got videos as well. So yeah, those resources will hopefully be useful, not just for Know Your Numbers, but for beyond that as well. And I think they're all hosted on PHE's blood pressure hub as well. If you do have high blood pressure, you will need to take action to bring it down. Next slide, please. So there are a range of different approaches to bring it down, but predominantly they fall into medication and lifestyle. There's robust evidence that taking action to lower your blood pressure reduces your risk to health. There was a major systematic review in the Lancet that found for every 10 milligram of mercury reduction in blood pressure, which is not a huge amount, that's equivalent to sort of one pill, resulted in a 17% reduction of coronary heart disease, 27% reduction for stroke, 28% reduction for heart failure, and a significant 13% reduction in all-cause mortality. And even half of that reduction, so a 5 milligram reduction, over 10 years could save 45,000 QALYs and save 850 million on related health and social care costs. So it really is very important. Thinking about the lifestyle, support for behaviour change to address those modifiable risk factors we talked about earlier should be the first step in preventing and treating high blood pressure. It's estimated that about 80% of premature deaths from cardiovascular disease could be prevented from better public health. In our research, we showed that 6 out of 10 people claim the COVID pandemic has not made them want to improve their general health, with a lot of people stating that they just have other priorities to focus on. Quite a few people also said that they thought they were already quite healthy. Nearly half were aware that an unhealthy diet raises blood pressure and a risk of stroke and heart attack. And as a result of the pandemic, again, just about half have said they've started eating more healthily, including fresh fruit and vegetables. Half have become more active, and 40% apparently eat less sugary, salty and fatty foods. But I will say that is definitely not borne out by the food data research that I've seen. But this is particularly important because it's so much research shows that eating too much salt is very strongly related to the development of high blood pressure, particularly the rise in blood pressure with age. And as a nation, if we cut just 1 gram of salt from our average daily salt intake, there'd be approximately 6,000 fewer deaths from strokes and heart attacks each year in the UK. And these lifestyle changes, such as eating less salt, less saturated fat, more fruit and veg, less alcohol, losing weight, taking exercise and even sleeping better, can help lower blood pressure about the equivalent amount. They can be as effective as taking a pill. And if you're overweight, your blood pressure is likely to be higher. If you lose the excess weight, you will probably find that your blood pressure reduces. The other side of the coin is medication. So I've mentioned antihypertensives. Your doctor or nurse may decide that you need to take medicine sooner rather than later, and that depends on your overall risk of heart disease, stroke and other health problems. So if you have high cholesterol, you smoke, have diabetes, or family history, you might want to start sooner. But what is quite shocking is that between half and 80% of patients with high blood pressure do not take their prescribed medicine as they are meant to do. And of course, if you don't take it, it doesn't work. And this means there's lots of people walking around knowing they have high blood pressure and not doing something about it. And this is why increasing control for those with the highest blood pressure has to be a big focus. So just knowing your numbers isn't enough. You do need to do something about it. In Canada, really interestingly, they've done loads of work on blood pressure in Canada, and 65% of adults with high blood pressure are diagnosed and managed to recommended levels, compared to just 35% in England. Next slide. This is our poster for Know Your Numbers week, so hopefully you'll be seeing that going around next week. We know what to do. We know we need to find people with high blood pressure and we need to treat them to target. We also know it's really cost effective. The challenge, so far as we have found it, has been very much in engaging the public. So again, in our research, 40% of people do not understand why they should know their blood pressure numbers, nor have they checked their blood pressure since the start of the pandemic. So there's a really big job to raise awareness and engage people, and to be really mindful of not exacerbating inequalities wherever we can. This is where we're hoping to need you. So say we normally have pressure stations around the country. This year we're having more of an ambassador role, so if you'd like to be involved or spread the word, we're looking for blood pressure ambassadors who can hopefully now converse easily about the risks of high blood pressure, such as heart disease, stroke and dementia, and reinforce those healthy lifestyle messages, particularly healthy eating and physical activity. We want you to please help promote blood pressure monitoring, particularly home blood pressure monitoring, by encouraging people to buy or share monitors, just as you would with a set of scales. You can direct people to our website and our free helpline, where you can find all sorts of information about choosing monitors, how to use it, how to look after your blood pressure. And as I said, we don't sell them ourselves. We have PR resource as well. So there's a press release that's just going out now with long copy facts figures from our public polling. It's been tailored to 29 different regions and cities across the UK. There's short and long form copy, and hopefully lots of quotable quotes, facts, figures and statistics. We have downloadable printable resources, poster, graphic, how to test your blood pressure, e-record card, testing guidelines, all aimed at individuals wanting to test their own blood pressure, or a family or friend's blood pressure as well. And we have our leaflets that have been translated into 32 different languages as well, all free to download and print. And a really helpful slide. People find the blood pressure chart that shows where your blood pressure lies a really helpful resource that shows what the numbers actually mean. Next slide, please. So yes, please spread the word on social media. We'll be launching that campaign on Monday with some lovely graphics like these. We're hoping to get Know Your Numbers trending again, and we can supply lots of useful statistics and text. And I know that Catherine's going to be sending that around to relevant people hopefully soon, when I've sent it to her. Next slide, please. We also have a video as well, both short and long version of the video, with a very good display of how to actually use a monitor and how easy it is. I would do a demonstration for you now if we had time, but I don't think we need to do that. But it's nowhere near as complicated as it looks, but people just need to feel a bit comfortable using it and confident that they're going to get accurate numbers as well. So this video is available for digital TV screens if you have any, and for sharing on social media. And if you're particularly interested, if you have high blood pressure or you know someone, we've launched a pressure panel, to help influence blood pressure care. So it's very important to us, of course, that our work and recommendations involve the experience of people living with high blood pressure. And the pressure panel is made up of a small group of people affected by high blood pressure who are willing to share feedback. So if you'd like to join that, please get in touch. Next slide. It's a really exciting time to be working in blood pressure, as well as our Know Your Numbers. There's so much going on with the pharmacy contract, digital programs, blood pressure at home, which I haven't even mentioned. There's trailblazer programs in blood pressure. There's the CVD prevention packs, the advice around making every contact count, and the work going on CVD Prevent. Because it's so important. The detection and control of high blood pressure is one of the best things we can do to save lives and reduce health inequalities. So we're looking to help develop and support initiatives for detection. So there's been accelerated adoption of innovative practices, so including digital home blood pressure monitoring linked to GP surgeries, which has really set a precedent for what can be achieved. But the use of technology should be mindful of existing and widening inequalities. We've been asking for monitors to be available. Many of us have been asking for monitors to be available on prescription for those that are most vulnerable for that reason. But we also have to be aware of sort of literacy and numeracy as well. We should be developing and supporting initiatives to promote public awareness of blood pressure. There has never been a blood pressure campaign that I know of, in the same way there has been for obesity or SALT, Better Health in 1 year. So that would be great. And also, I really hope you will support your PHE dietary improvement team as they move over to the OHP and continue to work on the really vital salt reformulation programme to take salt out of processed foods. We also need to encourage this collaborative working with partners across the health and social care system. This is something we learned from Canada, and you are very fortunate to have very dedicated leadership from Katherine, Hannah and the team in PHE, and also Dr. Shahad, Lucy, Cardiovascular Disease Prevention team at NHS England, amongst many others. There's many vocal voices in this area, and we just need to help amplify them wherever we can. So with your help, we're hoping to make this year the year of blood pressure monitoring. Next slide. So a little thank you in advance for supporting the campaign, and I think that's probably enough time. If you have any questions or anything you can tell us about your experience or anything you think would be useful for us to know, we would be delighted to hear it. So with that, I feel like it was a very whistle-stop tour of blood pressure, but with that, I'll pass you back to Katherine.
Oh, thank you for that really comprehensive overview of hypertension and the Know Your Numbers campaign, Katherine. That was fantastic. So we're open to questions now. You can choose to do that in one of two ways. So